Welcome to MH Health. In today's video, we talk about chickenpox and pregnancy. All information provided in this video is taken from Royal College of Obstetricians and Gynecologists, ensuring accuracy and reliability.
What if a pregnant woman come into contact with chickenpox? If a pregnant woman have had chickenpox, she will be immune and there is nothing to worry about. She do not need to do anything. If she have never had chickenpox or are not sure, she should see GP or midwife as soon as possible. She can have a blood test to find out if she is immune. 8 out of 10 women in this situation will be immune without realizing it. If she develop a rash in pregnancy, she should contact her GP urgently.
What if pregnant woman came into contact with chickenpox but not immune? If her blood test confirms that she is not immune to chickenpox and she come into contact with it during pregnancy, she would be offered a course of antiviral tablets called aciclovir or valciclovir. This is taken for 1 week, starting 7 days after she came into contact with the person with chickenpox. Aciclovir and valciclovir are not licensed in pregnancy but are considered safe. If she is known to have side effects from this sort of medication, she may be offered an injection of varicella-zoster immune globulin, VZIG. This is a human blood product that strengthens the immune system for a short time. She can be given the injection in the 10 days after you came into contact with chickenpox and before she develop any symptoms. It does not help once she have a rash.
What if she come into contact with chickenpox again? If her blood test shows that she not become immune, she can have a second treatment. This can be another course of antiviral medication starting 7 days after contact, or a second dose of VZIG if it is 3 weeks or longer since her last injection. What could chickenpox mean in pregnancy? If she develops a rash, she should keep the area clean and wash her hands regularly. She should avoid contact with other pregnant women and newborn babies until the blisters have crusted over. Rarely, chickenpox can lead to serious complications during pregnancy. These include chest infection, pneumonia, inflammation of the liver, hepatitis, and inflammation of the brain, encephalitis. Very rarely, women can die from complications. She is at greater risk of complications if she catches chickenpox when she is pregnant, if she smokes cigarettes, has a lung disease such as bronchitis or emphysema, is taking steroids or has done so in the last 3 months, or is more than 20 weeks pregnant. If any of these apply to her, she may need to be referred to hospital. What could chickenpox mean for her baby during pregnancy and after birth? The risk of her baby catching chickenpox depends on when in her pregnancy she catches it. The highest risk is during the last 4 weeks of pregnancy. If she catches chickenpox, up to 28 weeks of pregnancy. There is no evidence that she is at an increased risk of early miscarriage. Her baby is unlikely to be affected. However, there is a small chance that damage could occur to the eyes, legs, arms, brain, bladder, or bowel. This only happens in fewer than 1 in 100 babies. She will be referred to a fetal medicine specialist for ultrasound scans and discussion about 5 weeks after her infection, and discussion about possible tests and their risks. Between 28 and 36 weeks of pregnancy. The virus may be present in her baby's body, but will not cause any symptoms. The virus may become active again, causing shingles in the first few years of her baby's life, after 36 weeks of pregnancy. This is the time when her baby is at greatest risk of getting chickenpox. If she has chickenpox in the 4 weeks before birth, about 1 in 4 babies will also develop chickenpox, but her antibodies will help protect her baby. Her baby may get severe chickenpox if her baby is born within 7 days of her chickenpox rash appearing, or she gets chickenpox within the first week after birth. This is because fewer antibodies cross to her baby. Her baby will be given VZIG and treated with an antiviral drug called aciclovir and monitored closely after birth. Is it safe to breastfeed? It is safe for her to breastfeed if she has had chickenpox during pregnancy or after the birth of her baby. If she has blisters close to her nipple, she should not feed from that breast until they have crusted over. She can express milk from that breast and ask her healthcare professional for further advice about whether she can give this to her baby.
Stay tuned and subscribe to our channel. Hit the bell icon so you get the notification for next video. Thank you.